Now it's being recorded. Okay, good. All right, thank you for joining us this morning. Please type your name in the chat box so that we can get attendance. And today I'm actually going to be talking to you about complaints, grievances, and Medicare appeals, and the difference between those, and what we can do to help beneficiaries during this process. Of course, there is actually two types of complaints. There is a complaint, or it's called a grievance, and the appeals. There actually is a difference between the two. So a complaint is also called a grievance. Some people get those confused, but they're actually one and the same. So a complaint or grievance is it's a concern about the quality of care or other services that a beneficiary has received. For example, there's different types of grievances that a beneficiary can do, like if they called their plan and the customer service person was rude to them, they can do a complaint. So we'll go through some of these other types of complaints that beneficiaries can do, and we may actually have to help them. So when to file a complaint or grievances, here's some examples that I was telling you about. The poor customer service, when you face any administrative problems, your plan fails to return a coverage determination or appeal decision on time, your plan fails to expedite a coverage decision or appeal, poor quality of care from an in-network provider, poor customer service from a plan rep, you're asked to pay any incorrect, co-payment amount, anything like that. You're involuntarily disenrolled. Sorry, this is the school calling us to tell us that they're canceling. You're involuntarily disenrolled from your plan. There is a change in premium or cost sharing. You receive inadequate written communication from your plan, or of course, if they think they've been experienced any marketing abuse. So all of those that are types of complaints or grievances that a beneficiary can file. So how do they file a complaint? It actually depends on the type of service that they're going to be complaining about, I guess. If it's regarding a plan itself, they can actually call 1-800-MEDICARE to do the complaint about the plan, or that they can actually submit the complaint to their plan in writing. So if there's, if they're complaining about a doctor, hospital, or provider, improper care, unsafe conditions, definitely need to report those to their plan. And also, and I've put in here some other agencies where they can also file those complaints too. I would recommend doing both. Make a complaint with the plan and these other state agencies. For example, if it's improper care, unsafe conditions, they need to actually report that to their state survey agency. And of course, in Tennessee, it's the Tennessee Department of Health. And I've actually put embedded the website in the PowerPoint. So it's the Healthcare Facilities Complaint Intake Line, and that number is 1-877-287-0010. So, and I said, like I said, I recommend them doing both. That they, make the complaint to their plan and also call the Tennessee Department of Health. Hospital conditions, that's the same thing. Like if any complaints about the hospital is dirty, any poor housekeeping, anything like that, they need to report that to the Department of Health Care Facilities. Now, if they have a complaint about their doctor, that actually needs to be reported to the state medical board, and that's also through the Tennessee Department of Health, and it's actually reported to the Office of Investigations. Like your doctor did, any unprofessional conduct, incompetency, has any, think the doctor has a license to practice, anything like that, it needs to report to the Department of Health Office of Investigations, and that number is 1-800-852-2187. So there's some other state agencies that you can report to. Also with the plan. So I would call, for example, if they're on Original Medicare, I would call Original Medicare to make the complaint, and then also call these Tennessee state agencies. So that way it's doubly complained on. So if they have a complaint about their health or drug plan, for example, if someone's in the Advantage plan, then they need to send a letter to their plan's grievance and appeals department. And usually you have to check with either the plan's website, or usually that's giving in when their plan sends out their information. That's usually in that book as to the address and things like that. I highly recommend, if anybody has a complaint, they really need to file the complaint within 60 days of the event, so that it can be looked at timely. So, of course, you can also send your complaint to your regional Medicare office. Our regional Medicare office, I think it's in a little bit of a transition right now. We do have one, I think, in Atlanta right now, but I think, as I said, I think it's in transition, so I'm not sure exactly. We can check with Medicare as to where our office is. You can also send a complaint to your representatives in Congress if you feel that your problem hasn't been addressed. Of course, you can also call 1-800-Medicare to file a complaint if you think your plan has not done what they need to do. Now, if there's any quality of care complaints, those actually need to go through our Beneficiary and Family-Centered Care Quality Improvement Organization. Yes, that is a mouthful. It is BFCC-QIO for short. And of course, KIPRO's number is 1-844-430-9504 up on the screen. As you can see, not all KIPRO doesn't cover all states, but they do cover our state. So here's the other ones for the other states. If, for example, if you have a family member living in a different state, here's all the ones that KIPRO does cover pretty much half the country, and Levanta covers the other half pretty much. So they're split. So KIPRO for Tennessee is, here's the number. It's 1-888-317-0751 is the number. Or you can go on to KIPROQIO.com also, which is a really good website. So how do you file a complaint? Here is other places. So if you have a complaint about dialysis or kidney transplant care, who needs to be contacted is the End-Stage Renal Disease Network or the State Survey Agency. Tennessee does not have an End-Stage Renal Disease Network that I could find. So pretty much they would need to report to the Tennessee Department of Health, healthcare facilities, the complaint intake line, that other number that I gave out, the 1-877-287-0010. Now, if you have a complaint about durable medical equipment, if it's about the equipment, like, you received it but it was broken or it doesn't fit, you didn't order anything like that, I tell beneficiaries, one, contact the supplier first. If the supplier does not handle the complaint, definitely call 1-800-Medicare. You can actually call both. So once you file your complaint with your supplier, they have to let you know they got your complaint and are investigating it within 5 calendar days. They must send you the result of your complaint and their response in writing within 14 calendar days. So just some things to know about the durable medical equipment. Really, if a supplier has sent you some supplies that you or your doctor did not order, that actually goes into fraud. So you all need to call me. Call my toll-free number of 1-866-836-7677, because the brace scam is still going on. I'm still getting calls from beneficiaries where they're getting calls to callers claiming to be from Medicare and asking about their pain. So just FYI, that brace scam is still going on. It's not as bad as what it was, but I'm still getting complaints. So please, if you all get any of those, let me know. Or if a beneficiary gets a box of braces they didn't order, anything like that. So the next one I was going to talk about is an appeal. So an appeal is a formal request for review of a decision made by Original Medicare, Medicare Advantage, or a Part D plan. So a complaint or grievance is regarding the service, like they didn't get, customer service, anything like that. An appeal is of a decision that has already been made. So keep that in mind. That's what's the difference. So when does a beneficiary file an appeal? They can appeal if their Medicare or their plan denies your request for healthcare services, item, or drug they think should be covered, provided, or continued. Request for payment for a healthcare service, item, or a drug they already got. For example, they got services, but they had to pay for some reason out of pocket, and then they sent that request in to their plan to get reimbursed. Their request to change the amount they pay for a healthcare service, item, or drug. For example, if they get their explanation of benefits or the Medicare summary notice and it says to pay more than what they think they should have to pay, they can file an appeal. Another thing I tell beneficiaries, especially if we're having to help them file an appeal, it helps if you get your doctor on board with filing an appeal. If your doctor can provide any, like in a letter or anything like that, any information to help your case, so that Medicare may decide to pay for that service. So anything would help. So 5 things to know when filing an appeal. As I said before, if they decide to file an appeal, ask their doctor, healthcare provider, or supplier for any information that can help the case. If you think your health could be seriously harmed by waiting for a decision about a service, ask the plan for a fast decision. If the plan or doctor agrees, the plan must make a decision within 72 hours. So if they're needing like a medicine, for example, if they're really needing a medicine and the plan is refusing to pay for it, they need to ask for a fast appeal. Or an expedited appeal, fast appeal. They need to ask for that. And most beneficiaries don't know they need to ask for that. So the plan must I'm getting some serious feedback. The plan must tell you in writing can you mute that person? So the
I've got everybody I can mute.
Okay. The plan must tell you in writing how to appeal. After you file an appeal, the plan will review its decision. Sorry, guys. Okay, now. Okay. So the plan must tell you in writing how to appeal. So usually they give that in the information when they first send their card and stuff like that. After you file an appeal, the plan will review its decision. Then, if your plan doesn't decide in your favor, the appeal is reviewed by an independent organization that works for Medicare, not for the plan. And most people don't know that. So if they plan to appeal, and if they, especially if they need a fast appeal, they need to ask for an expedited decision. If a beneficiary is believed, they're being discharged from a hospital too soon, a rehab place too soon, anything like that, that complaint actually needs to go through KIPRO, and they also need to ask KIPRO for a expedited review also, so that KIPRO can help, especially if you don't think someone should be discharged from the hospital. And the beneficiary should be able to stay in the hospital while under review. And the hospital cannot force someone to leave the hospital before KIPRO reaches a decision. So keep that in mind. So that's, beneficiaries knowing their rights. And, if you're working with a beneficiary, this, as volunteers, we all need to know that hospitals cannot force someone out before KIPRO makes a decision. So that's why then when you're talking to KIPRO, you need to make sure that this is an expedited decision. Also, you have the right to a fast-track appeals process when you disagree with the decision that you no longer need services you're getting from a skilled nursing, home health, or a comprehensive outpatient rehab. So that's why you really need to fast-track those appeals. So ask for an expedited appeal. Okay. Can someone else file an appeal on a beneficiary's behalf? As a SHIP and SMP volunteer, you can actually help someone file an appeal, but you cannot do it for them because they actually have to sign it. You can help them do it, type out whatever you need to do, but in the long run, you can help them stick an envelope, things like that, but you can't do it for them. Beneficiaries can actually appoint a representative to help them during that process. They can appoint a family member, friend, advocate, attorney, doctor, or someone who will act on their behalf. So in order for them to appoint a representative, they have to fill out a form and sign a form. It's called the appointment of representative. I highly recommend doing this to any, if you have any elderly parents, if you have beneficiaries' children that you're talking to, anything like that. I highly recommend, getting this appointment of representative for them. So this can help actually, that where they can actually let the children of the beneficiary talk to Medicare and things like that. So this is a really good thing. So appoint a representative. I highly recommend this. So they can also submit a written request with their appeal that includes their name, address, phone number, and Medicare number. A statement, so they have to write out a statement appointing someone as their representative. That representative's name, address, and phone number. any professional status of the representative, like if it's their doctor or how they are related to that beneficiary. A statement authorizing the release of your information, personal information, and identifiable health information to your representative. So they have to put in that statement, I authorize Medicare to release my personal health information and any identifiable health information to my representative. A statement explaining why you're being represented and to what extent. I mean, they can say, I don't feel, like, for example, I have a hard time reading. I'm, doing this appointment so my child, whoever it is, my representative can, explain why, due to health concerns, whatever it may be. So send the representative form or written request with your appeal to the MAC, and usually the MAC is the, it'll have that on the very last page of the Medicare summary notice. I always tell beneficiaries, if you're needing help with an appeal, bring your whole Medicare summary notice with you, especially the last page, because one, you've only got 120 days to file an appeal, so you have to have that date. Plus, it has the MAC's name and address on that last page, so you really, really need that last page. So, as I said, look at the Medicare summary notice. Actually, if they bring their whole Medicare summary notice in, get that very last page, because that'll have the date and the address on it. And it actually has steps on the very last page of the Medicare summary notice on how to file an appeal. So if you're having to help someone do that. Or, if they don't have that, you can fill out a, redetermination request form. You can find that on the CMS's or Medicare's website. You can usually find that. Their address is usually listed in the appeals information on the section of the MSN. Or send a written request to the company that handles claims for Medicare to the address on the MSN. So you can do this in writing. Include the information in your written request, name, address, and Medicare number. Also, anything that you're sending to the MAC, make sure they put their name and Medicare number on each sheet of paper that they're sending. Circle the item or service that they disagree with, or list specific items, and also it would help if you put the code out beside it, and explain what the service was. An explanation of why you think the item or service should have been covered. Detailed explanation would be good, and this is where it comes in. It'd be very helpful if you get anything from the doctor saying, the doctor ordered it, why the doctor ordered it, any letter from the doctor or anything would be very helpful. The name of the representative, if they've appointed one, and any other information that could help their case. And I said, if you can get the doctor on board with help filing an appeal, Medicare looks at that. So here's appeals in if someone has an Advantage plan, or any other plan out there. Usually the appeal process starts with their plan. So usually on that explanation of benefits, or whatever they get from their plan, it'll have directions on there how to file an appeal. So they need to follow the directions in their plan's initial denial notice. The beneficiary, the representative, or their doctor must ask for an appeal from your plan within 60 days. So keep in mind, if it's an Advantage plan, that's 60 days. If it's original Medicare, they've got 120 days. So there's a lot of difference between original Medicare and Advantage plans coming along with appeals. They have less time to appeal in a Advantage plan. And of course, if they miss the deadline, they must provide a reason for filing late. And I'll go over some of those a little bit later, some of the reasons why beneficiaries can actually file late. Include this information in your written request. Name, address, Medicare number again, item or service for which you're requesting a reconsideration, name of the representative or proof of representation, if they've appointed one, and any other information to help with the case. If you think your health could be seriously harmed by waiting the standard 14 days for a decision, ask the plan for an expedited decision. And the plan must give their decision within 72 hours. So how long their plan has to respond to request depends on the type of request. Of course, the expedited is 72 hours. Standard service request is 30 calendar days, and payment request is actually 60 calendar days. So keep those in mind. And as I said, the appeal must be filed within 60 days from the date of the coverage determination for an Advantage plan. So appeals in the Medicare prescription drug plan, of course, they got to start the appeal with their plan. If they're asking to get paid back for drugs they already bought, the beneficiary or the prescriber must make the standard request in writing, so they actually have to write their plan. Or send them a completed it says model coverage determination request form. And usually they can find it, they can ask for their plan. You can usually go on their website and find it, anything like that. If asking for prescription drug benefits they haven't gotten yet, the beneficiary or the prescriber can ask the plan for a coverage determination or an exemption. To ask for a coverage determination or exemption, they can do one of these. And most of the time, the doctors already know what medicines they have to get this coverage determination for. So if you get your doctor on board or even your pharmacist, that helps a whole lot. That goes a lot. So again, the doctor or the beneficiary, has to complete that coverage determination request, write their plan a letter, call your plan. If you're asking for an exemption, your prescriber must provide a statement explaining the medical reason why the exemption should be approved. If you didn't get the prescription yet, you and your prescriber can ask for an expedited, so they can ask for an expedited one, especially if they're needing the medicine like right now. So I highly recommend asking for an expedited one. If they ask for an expedited one, the plan has 24 hours to make a decision. If it's a standard service request, it's 72 hours. Any payment request is 14 calendar days. So that's the appeals and Medicare prescription drug plan. So appeals in the PACE program, we've only actually got one PACE program in the state, and I think that's in Chattanooga. So if they have coverage through the PACE program, their appeal rights are a little different. And the PACE program should provide the beneficiary with written information about how to file an appeal. Appeal in special needs plans, these pretty much it's the Advantage plan, how they have to file an appeal through their Advantage plan. Their plan must tell them in writing how to file an appeal. After they file an appeal, the plan will review its original decision. If their plan doesn't decide in their favor, the appeal is reviewed by an independent organization. So here's the appeal process I put up there. Under original Medicare, there is 5 levels of appeal. Of course, the first one is the initial determination, and that's, the MAC actually makes the initial determination. Then the first level of appeals, they got 120 days to file. So that actually goes to the MAC redetermination, and they have 60 days to determine the time limit. So they have 60 days to determine that. So they'll send a letter back out to the beneficiary, let them know that what their decision is. And then, of course, the second level appeals, you've got 180 days to file the second level. So that actually goes to the Qualified Independent Contractor, the QIC, and they actually have 60 days to determine if Medicare will pay for it or not. So then they'll send the beneficiary another letter letting them know their appeal decision. Then you've got only 60 days to file the third level appeal, and that actually goes to the Office of Medicare Hearings and Appeals. That's if the amount in controversy is over $160. And it says they've got a 90-day time limit to make that decision. So if it's over $160, then it can go to the third level of appeal. And then they've got 90 days to make that decision. Then if it wasn't in their favor, you've got 60 days to file the fourth level of appeal, and that actually goes to the Medicare Appeals Council, and they have 90 days to appeal, or they have 90 days to make their decision, sorry. And then, of course, if it was unfavorable, you've got 60 days to file the fifth level of appeal, and that actually goes, and this is where it goes up to the judicial review. It goes to the federal district court, and that's if the claim is, above $1,630. So and this is the appeal process in original Medicare. So this says the AIC and requirement for all appeals at the Office of Medicare Hearings and Appeals and Federal District Court is adjusted annually in accordance with the medical care component of the Consumer Price Index. So just FYI, that's how they get that amount, the amounts in controversy. So here's the appeal in original Medicare. So here's the appeal process for Advantage plans. It's a little bit more complicated. There's still a 5-level of appeals, but it starts with the, of course, the initial determination. There is the 14-day time limit. The 60-day time limit for payment, or Part B RX is 72 time limit. Of course, on one side you've got the expedited and you've got the standard, and the other side you've got the expedited. So they've got 14 days to determine. After that, if it wasn't in your favor, the first level of appeal, of course, is keep in mind, they have 60 days to file the appeal. The health plan, reconsideration, they've got a 30-day time limit. For payment, it's 60 days, and for Part B RX, it's 7 days. So then they've got, pretty much depends on what type of it is. Then if it goes to the second level, you've got, 60 days to file the second level. Then it goes to the independent review entity, and they've got 30-day time limit. For payments at 60 days. For Part B RX is 7 days. For the third level appeals, 60 days to file the appeal. And of course, it pretty much, for some reason, the amount changes here. It goes to the Office of Medicare Hearings and Appeals. That's if it's $160 well, this says 160. I think they changed it this year to 170. So that one's, I think on here is not correct. I think they changed it this year to 170. And of course, you know, they've got so much time to, no statutory limit for processing. So keep in mind that's another one. No statutory time limit for processing. So they can take as much time as they want to, obviously. On the fourth level appeal, you've got 60 days to file, and that actually goes to the Medicare Appeals Council, and there is no statutory time limit for processing. The fifth level of appeals, it goes to the federal district court, and of course the amount went up to 11670. So this year, and I think they just come out with that not too long ago. That's a 2020 amount. So in Medicare Advantage plan, it starts a little bit different, but then when you get down to the actual appeal process, it pretty much looks like the appeal process for original Medicare. So Part D, drug appeals. You've got, for a standard process, it's 72-hour time limit. The first level of appeal is to the prescription drug plan, Medicare Advantage plan, redetermination. They got seven-day time limit, or a 14-day time limit for payment. And this is for a standard process, not expedited. I highly recommend, if a beneficiary thinks that they need a medicine right then and there, definitely ask for an expedited process. Then the second level is the independent review. There's a 7-day time limit for that. And of course, all of these, the beneficiary actually has 60 days to file. Third level appeal, it's the $170. The fourth level, it's the Medicare Appeals Council decision making, 90-day time limit to make a decision. And the fifth level appeal, of course, it has to be close to the 1,670. So I put this slide up here. This is the Medicare Beneficiary Ombudsman. If anybody has any issues with Medicare coverage, Medicare rights and protections, getting any issues resolved, the beneficiary, I highly recommend the beneficiary calling. Or, if you're a volunteer and you've been trying to help someone get this resolved and it's not been resolved, I highly recommend calling Medicare or calling, using our unique ID and asking for this complaint to be sent to the Medicare Beneficiary Ombudsman. They're the ones that reviews complaints and helps get them resolved. So what they do is they review the concern raised by the people with Medicare, and of course they actually have to report yearly to Congress of all the referrals that they've gotten. But beneficiaries don't know to do this. I tell beneficiaries, if you're still having a problem with your plan or anything like that and you still cannot get it resolved, call 1-800-MEDICARE and ask for your complaint to be sent to the Medicare Beneficiary Ombudsman. That's the only way we can actually get the complaint to them. It has to go through 1-800-MEDICARE. So here's some Medicare resources I have put out there, or that's out there. You got CMS.gov, you got Medicare.gov, and make sure it is .gov. There is others out there. Don't do the Medicare.com. That's actually an Advantage Plan company. So make sure it's .gov. Medicare.gov, claims and appeals. Social Security if there's any issues with Social Security. HHS.gov is the Office of the Civil Rights. That explains some of the Medicare rights and protections. Some other resources, the Medicare Beneficiary Ombudsman. Here is some forms up there. Of course, SHIPs. The KIPRO, QIO, here's the website for them. And I've actually given them, the number back through in one of the slides. So that is the quality of care. That is the Beneficiary Family Centered Care Quality Improvement Organization, is KIPRO. Independent review entities, the Medicare Advantage and the Part D claims only. Here's some appeals for those. These are forms and stuff like that that we can get to. Of course, you got your Medicare and Handbook, UN Handbook. I really highly recommend that. If you don't have one, if you're a volunteer, you really need to get one. Having the Medicare Rights and Protections, there's actually a book on that too. And the Medicare Appeals. I highly recommend it if you're doing counseling with beneficiaries to get all three of these. And you can ask for copies from Medicare publications. It's actually under productordering.cms.hhs.gov. So anybody, especially the program coordinators, you can register your organization and you can order these copies for your for the beneficiaries and the volunteers. If you all have any problems, I can order these from Medicare. So if anybody wants anything like this, let me know, and I can order it for you and have them sent to your house or whatever. So any volunteer can request any of these. And it's good to have on hand, especially if you're doing counseling. Another one it's a good, and I've actually attached it somehow through, and I can attach it in my email when I send out my slides and everything like that. It's called the CMS National Training Program Web Resource Tip Sheet. There are several different resources on this tip sheet that I'll attach when I send out the slides. It's got a lot of good information, a lot of CMS information, a lot of Medicare information, even goes into the Medicaid.gov. It's resources for states, even marketplace.cms.gov, so it explains some of the marketplace information on it. It's got healthcare.gov on there, Insured Kids, now.gov. It's operated by CMS. It's got Social Security on there. Regulations.gov is source for U.S. government regulations. Got the electronic code of federal regulations. That's on there. So it's got a lot of good information on it where you can click around and it'll bring the sites up for you. So, and also it also has on here read, print, or order free Medicare publications. So that's always good to know. So I'm pretty much, does anyone have any questions? I can open it up for questions now.
Lonnie, there was a question in the chat, and I'll read it to you. It says, I have a gentleman who is new to Medicare and is in process of choosing his coverage. On Plan Finder, the price for one of his drugs went from about $600 for a 3-month supply last week to over $1,200 for a 3-month supply this week. If we file a complaint on this, what are the chances that he would be able to get the $600 cost? Any other recourse for this gentleman?
Okay, so I'm thinking Plan Finder was showing the price, correct?
Correct.
Okay. That's one of those tough ones where the price may not have gotten changed in Plan Finder fast enough, or did he go to a different pharmacy? I mean, there's a lot of different things. If you did you print that off, the plan finder information, when you first signed him up?
So
I've unmuted everyone so that they can respond, but I'm going to have to mute it because I don't think we can hear. Helen, can you answer her real quick?
he printed out the plan finder information last week. He's sending that to me.
Okay, good. Yeah, 'cause that might help to go along with a complaint. I don't know. I mean, I don't know. CMS might or Medicare might give him a special enrollment. I mean, it can go several different ways. CMS or Medicare can give him a special enrollment, or he can enroll into a different plan. They may give him that as an exemption or something. I don't know. There's different ways that actually can go. But definitely need to file a complaint. Because I think that goes back to some of the plan finder issues we've been having also.
Lonnie, there's another chat question. It says, what should a beneficiary do when a provider is not cooperating? I've had a couple of folks say the hospital wouldn't release medical records or that they sent the info to KEPRO, but KEPRO didn't get it.
Definitely file a complaint. I mean, you can file a complaint to the Department of Health with that provider. I don't know, with, there's some hospitals that they have to release your medical records. Now, you may have to pay for them to get a copy, but they have to release your medical records to you. As I said, but you might have to, or beneficiaries may have to pay for them, and it could get expensive. Some hospitals charge 10, 50 cents a page. So keep that in mind. But yeah, they have to release your medical records, and if they don't, then they need to report it to. Depends on what type of Medicare. Report them to Medicare, and report them to the Tennessee Department of Health.
Lonnie, at this time, I'm going to go ahead and stop the recording, but we can continue with questions if you'd like.
Okay.